Hello, Nursing 330. This is Miss Ellison. I hope that you guys are having a wonderful fall break, but please let's not forget that you do need to review some stuff before class next Friday. Cardiac review has all of the information that you should be coming to class with already from previous courses. So if you need to brush up on the circulatory pathophysiology, the physiology, the A&P, it's all right here under this folder. There is a cardiac assessment documentation that I created. There is a website of heart sounds if you need a brush up on what normal heart sounds are and what abnormal heart sounds are. There is a 22-minute video of the circulatory system, which is an overview video. You can watch that if you need a brush up. There's 2 videos from Khan Academy on here. They are brush up videos. Please do not feel obligated to watch them, but they may help you remember some things, and you may learn new things. There is a registered nurse RN video about the blood flow through the heart. If you would like to watch it, please watch it. If you don't want to watch it, do not feel obligated to watch it. Then there is a couple of songs that might help you. And you, again, don't have to feel obligated to watch it, but if you want to watch it, please do. And no, I did not sing this Blood Flow Through the Heart song. And then there's a video about the heart under pressure by Crash Course A&P, which is a 10-minute video. I think it's a really good video to watch. You might learn something watching it, but again, do not feel obligated to watch it. It's only if you feel that you need a refresher. Then there are the cardiac medicines and other miscellaneous items. If you need to brush up on your medicines, please feel free to look at that folder. The test will have quite a few questions related to medicines on it, and I do not plan on discussing medicines as in depth as we discussed them last Friday. I will mention them in passing, but I might not focus on them from here on out. It just depends on time. We then have the hypertension folder. For this chapter, you need to read chapter 36 in ATI before coming to class. Please read it. You also need to do the system disorder template on hypertension. There's a video about the major effects of blood pressure. It's a very short video, so please watch it. And then there is a PDF that I put up here about taking your blood pressure at home. And then there's a Khan Academy video for high blood pressure. You can or you don't have to watch it. I don't care. It's just there if you want it. There's a PDF of the JNC8 guidelines. And then there's some discussion from the American Heart Association and the American College of Cardiology. Right now there is some debate as to our blood pressure numbers. So the American Heart and the American College of Cardiology says that anything over 120/80 is elevated. And it starts labeling stage 1 hypertension at 130 and stage 2 hypertension at 140. Whereas JNC8, they say stage 1 hypertension doesn't start till 140 and stage 2 hypertension is 160, I believe. So I'm not going to give you a test question related to stage 1 versus stage 2 because there's debate right now as to what those numbers are. 120/80, anything over 120/80 is elevated. But some people don't consider it high blood pressure. Other people do consider it high blood pressure. They don't consider 130/80 high blood pressure. They do consider 130/80 high blood pressure. So high blood pressure is not starting for us until 140/90. That is when high blood pressure is starting for us. The only real numbers that I want you guys to remember as far as blood pressure is hypertensive urgency versus hypertensive crisis, which we'll discuss next Friday. Hypertensive urgency is 180 over 110, and hypertensive crisis is 180 over 120. Okay, so blood pressure for this class, 140 over 90, and then hypertensive urgency, 180 over 110, and hypertensive emergency, 180 over 120. Those are your numbers if you have to have black and white numbers. Now, please remember to read your ATI, chapter 35, when it comes to, or chapter 36, excuse me, when it comes to hypertension. Read that before class. We then have angina and myocardial infarction, of what the ATI chapter is called. I'm just calling it coronary vascular disorder. But chapter 31 in your ATI book is related to that. Now, there are, like, it talks about angina and then it talks about heart attack. We are only focusing on angina, stable angina. So when it starts talking about MI, please peruse that, but don't waste a lot of time on it, because the only thing that we're really focusing on with MI is the difference between stable angina and stable or unstable angina, excuse me. And there is a great chart in your ATI book, if I can get to it, about, I should have already had it up so I wouldn't be doing this, about stable angina and stable and unstable angina. I don't know why I can't say that correctly. And I am almost there. That would be great if I could get there. So look at that chart so that you can see the difference of the two. And then, so here's the chart. Please look it over. And then it starts talking about MI, and you don't really need to know cardiac catheterization because we're not going to go into percutaneous coronary intervention because that's more critical, and we're not really going to go into MI classification. But we will talk about patient-centered care, and we'll talk about medicines when it comes to stable angina. So there are some medicines here that are kind of important for you to know. And I'll talk about which ones, as far as thrombolytics, are important for you to know, and what's important to know about thrombolytics and anticoagulants, because thrombolytics and heart attack are a lot more, that's more critical. So we're not really going to go into thrombolytics too terribly much, but there are some types of anticoagulants that are very important for you guys to know. Heparin, enoxaparin, Coumadin, and they have different reasons for them, not just for heart attack. It's for other reasons as well, and I will discuss those reasons in class. All right. There is a very short video on metabolic syndrome, which is really important to the prevalence of coronary vascular disease. It's like 5 minutes. Please watch it. And then there's another short video on understanding coronary vascular disease. That's 5 minutes. Then there's con videos. So you don't have to watch the con videos, but if you want to watch them, they are there for you. And then we're going to talk about the structural, valvular, and inflammatory issues. And this is chapter 33 and chapter 34 in ATI. There are a lot of references here for you. Grapefruit juice and drugs don't mix. That's a good one. And then there are just short little readings about pericarditis, endocarditis, atrial septal defects. So if you want to read over those before class, you can. Not mandatory. What is mandatory is reading chapter 33 and chapter 34. So before class, what you need to read is chapter 27, because that is about your cardiovascular and therapeutic interventions and tests. Page 161 to 162, and then on 162 it starts talking about hemodynamic monitoring. We are not talking about hemodynamic monitoring in this class because it's more critical care. So when you see hemodynamic monitoring, you can skip the rest until page 164 and then finish the chapter out. So chapter 27, page 161 to 162, hemodynamic monitoring. Stop reading there and start reading back on page 164 and finish the chapter out. You're going to read chapter 31. You're going to peruse when it starts talking about myocardial infarction, but you're not going to sit on it and try to read it over and over again. And then you're going to finish the chapter up when it talks about meds. You're going to read chapter 33 and 34. Those are your valvular and inflammatory disorders. And you're going to read chapter 36, high blood pressure. Remember to do your system disorder templates on high blood pressure and coronary artery disease, focusing on stable angina. We are not going to discuss chapter 32 or chapter 35 next Friday. Those two chapters will be discussed on November 2nd. So on November 2nd, we will do heart failure, pulmonary edema, and peripheral vascular disorders. So focus on what I'm telling you to focus on before class so that you can come to class with an understanding of what we are going to discuss. I hope you have a wonderful break, and thank you for taking the time to listen to me talk.